Vertebral axial decompression therapy, or simply decompression therapy. What is it? What is it used to treat? Can it help my condition? I get asked these questions all the time, and that's why I created this video to help you understand what it is. Hi, I'm Dr. Brad Mouroux, and I want to introduce you to what the research and I consider to be one of the most highly effective, non-surgical, non-drug treatments for chronic spine pain. Spinal decompression therapy is a safe and effective treatment for acute and chronic pain of the neck and lower back. This therapy addresses various conditions such as herniated and bulging discs, compressed or pinched nerves like sciatica, spinal stenosis, degenerative disc disease, and facet arthrosis, which are among the most common issues that we encounter and treat. What we do, we use a state-of-the-art, FDA-cleared spinal decompression system designed to explicitly for mechanical decompression of the spine. This procedure was actually invented by a spinal neurosurgeon, Dr. Alan Dyer, in 1991, and decompression therapy was developed as an alternative to spinal surgery due to the risks and relatively low success rates associated with spinal surgery at the time. While spinal surgery is sometimes necessary and helpful, it should be viewed as an absolute last resort due to its risk and irreversible nature. What does spinal decompression therapy do? Simply put, it targets a specific level of the spine, employing a computer-controlled program designed to keep spinal muscles relaxed while allowing for the vertebra, which are compressed, to be gently separated, causing damaged disc material to be retracted or sucked back in and stretched. When it stretches, it creates a vacuum effect. This vacuum effect is a negative pressure that is created inside the disc, which draws in water and nutrients, allowing the discs to expand and rehydrate, delivering necessary nutrients to the cells inside the disc, thus enhancing the natural repair process. Other therapies like inversion or hanging off a pull-up bar fail because they cannot achieve this vacuum effect due to the core muscle guarding and restricting the spine. Look, research from Harvard, Stanford, and the Mayo Clinic all indicate that this therapy is highly effective with a success rate ranging from 75% to 91%, all treating disc-related back pain. Furthermore, it is safe and comfortable, with the primary side effects being mild soreness or patients occasionally falling asleep during treatment. So, how long does treatment take? Well, based on the research from studies since 1991, it takes 8 weeks of treatment to get an effective change inside the disc. And that's because natural healing does take time, because we need enough circulation to happen regularly enough to occur inside the disc for it to have a chance to repair. And that is consistently supported in all the research. And so one must understand that it takes a commitment both on the patient's part and the doctor and staff's part to have the correct desired outcome with decompression therapy. I've been practicing as a board-certified chiropractor for 14 years. I'm also board-certified in sports chiropractic and have additional credentials in applied kinesiology, spinal trauma care, MRI interpretation, and soft tissue injury. My holistic approach to care involves a 5-step process. The first step of the process begins with spinal decompression therapy and is then followed by all the other key steps to address the underlying causes of pain and to improve spinal balance and function more long-term. The second step is actually supportive therapy care, such as cold laser therapy and electrical analgesic stimulation. Now, known for its ability to accelerate healing, cold laser is a type of infrared light therapy that is well known for its ability to stimulate healing inside the tissues by focusing photons of light to stimulate the cells on a cellular level, and thus will help with the healing of muscles and ligaments. Electroanalgesic stimulation is a supportive therapy which aids in pain reduction and recovery by increasing circulation, stimulating the muscles and the nerve activity for pain relief. And then the third step, my favorite step, is spinal manipulation or chiropractic care, which has long been proven to be effective in restoring spinal balance and function by addressing the locked segments of the spine that contribute to pain generation. And our clinic offers various techniques from low force to no force to suit individual comfort levels. Now, the fourth step is, of course, nutrition. It plays a crucial role, and we emphasize healthy daily habits and dietary choices to reduce inflammation and support the body's healing process, such as eliminating sugary and highly processed food and recommending specific supplements to aid in your recovery, as well as eliminating allergenic foods like gluten and dairy. The fifth and final step involves exercise and stretching to rehabilitate the body and the spine while also educating our patients on long-term self-care practices. However, we don't start this process until a little later in the program when the body has had a chance to heal before we cause it to be loaded with exercises. We must have some integrity in the joint before we load it, or we just continue to aggravate the condition. Our goal is not just immediate relief, but empowering patients to maintain their health long-term. While everyone can experience different results, our care has an over 80% success rate, making it a worthwhile alternative to surgery or long-term drug management, which isn't a solution. I have recommended this therapy to my family, myself, and my patients because of its proven success and the positive impact it has had on our lives. Personally, I've experienced a bulging disc in my neck that impacted my health and literally my career. And I relied on decompression therapy to recover for myself, so I know what it feels like. So come in and let us perform a comprehensive consultation and examination, including a review of your existing x-rays and MRIs. And don't worry, if you don't have any, we'll order the appropriate ones for you. During this whole process, we'll discuss treatment options, costs, and potential insurance coverage to tailor a plan that is suited to your needs. That is, if we think we can help you with our care. Now, if this sounds right to you and you are looking for answers, call us today to schedule your appointment. There's no risk, only the potential for a brighter, healthier future. I look forward to meeting you.